president for this year. A word about our bell. We actually have been awarded the governor's bell, and it is currently in my drop zone right inside the back door to my home, and along with the plaque that we also were awarded. So I will bring that and share that with all of you next week. That is a traveling trophy, and so we'll place that into the new Rotary office and let all of you see it there. With that, let's say the Pledge of Allegiance and start our meeting. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. Dr. Grace Morrison is going to do our guest introductions and Rotary Minute this morning. And while she's on her way up, I will share with you that our May featured charity is the Topeka Library Foundation for the Dolly Parton Imagination Library Literacy Program for children birth through age 5. This program will allow 14 children to participate and be ready for kindergarten. Each enrolled child gets in the mail a free age-appropriate book every month. So that's what our cup money goes to for this month, so please give generously. Thank you. Grace?
I'm very pleased to introduce 4 guests today. The first is a member of the Kahrs Rotary Club in Manhattan, and this is Yusha Reddy. Hi, Yusha. And we have a guest who just came, and we are so glad that she's here. She's with Washburn University with the AmeriCorps Vista, and this is Melanie Burns. Hi, Melanie. We have a guest of Joni Underwood, and this guest is the Assistant Director of the KBI, and this is Tony Weingartner. Hi, Tony. And finally, we have a guest whose application is already in process, and this is Yana Ross's guest. Our guest is a dentist with enchanted smiles, and her name is Stefania Caraccioni. Hi, Stefania. Well, let's give a warm Rotary welcome. Pleasure of doing the Rotary Minute today, and most of you know that there are 1.2 million Rotarians worldwide, organized into zones, districts, clubs, and a whole lot of good has been done. Together, it's amazing what can be accomplished. We all know that in the mid-1980s there were 350,000 cases of polio every year. Last year, because of the Rotary efforts of Rotary, there were 33. So we are really, really close. Which brings me to last weekend. Did we not have the best district conference ever? I can tell you that it really was the best, because Larry Kimmett, who has been to zone conferences and many, many district conferences, says it was the best that he had ever been to. We had incredible leadership under Anita Volgast and District Governor Blanche Parks. And the point I'm making is that countless Rotarians were involved in making this a success this weekend. Everybody did so many things, either big or little, but we all gathered together. I'm going to pick on one person just because I asked her to do it. Allison Marker's part was to go shopping for fleece fabric so that we could then cut it up and turn it into blankets for the Fresh Start kids. There are hundreds of people who were involved just like that. And this is the power of Rotary. Everyone doing their part, however large or small, and accomplishing amazing things. So let's give ourselves a hand for a fabulous district conference.
Thank you, Grace. And while I'm continuing with a few other announcements, we'll have Blanche Parks come up as well. Our district governor wanted to say a few words about the conference. We are looking for some more host families starting in August of 2019. And so if you're interested in that, please see the young woman with the adorable accent who's also wearing bright colors at this table. So the bright colors are necessary because there's at least 3 people with a great accent there. So, Blanche?
Hi, everybody. It really is a great day to be a Rotarian. Really, really. I tell tell you, after that great weekend, and thank you, Grace, for your nice remarks. And so how many of you participated in any way? That meant if you gave money, helped with a project, or could you just stand so we can see you? Anybody who did anything? Okay, look at that. Thank you so much, everyone. And we just had a great weekend. And Anita, thank you, Chair of the conference, and your committee of Orion and Carol Jordan, Yana, and Linda Ireland. Could you guys stand up? And I tell you what, we've been planning now for months and months and months, and this club is so awesome. I just don't know what to say. You're just awesome. We just had all kinds of people getting recognized and everything. We had a survey, and people said that they wanted to just have fun. They wanted to learn about Rotary, but they wanted to have fun. So that was the goal of our committee, was to have fun and have a different type of Rotary district conference, and we were successful. And I have received lots and lots of compliments. And we involved young people like they've never been involved before. And we had a live remote from the Rotaractors at Kansas State University. You know, we had the Topeka High School drum line and ballerinas, and we had so much going on you wouldn't even believe it. And so anyway, I want to thank everyone so much. And so on your tables is a liter of ginger ale. So could you grab a glass and could somebody open it, please? And we're going to have a toast. Okay, all right.
More than pass around, how's that?
I'll give you a couple minutes before I
Same this way. More than that?
If your table doesn't have any, just go to another table so we can share.
Nope. I'll take her one up there.
Okay.
Got an extra cup.
All right, everybody, we're having too good of a time and we haven't even toasted yet. Okay, I want to give a toast. Now, President Mark mentioned that this club received the governor's bell, and it's really nice, and he'll bring it next time. And the governor's bell is passed from year to year to various clubs, and so each governor awards this governor's bell to the club that they think is just hit it out of the park, you know, just the best in every way. Well, you know what? I had to pick this club because, and you know what? You're not supposed to pick your own club, but I had to because I could think of another club that was so helpful and just so much symbolic of service above self than our club here today. So I want to propose a toast to the Downtown Topeka Rotary, our Rotary Club of Topeka, and I would say you are the best Rotary Club in the whole wide world. And so, anyway, I also want to give a toast to our president, Mark. He's just been an excellent president this year, and he also has another plaque that he'll bring too. And so let's toast Mark. Okay, one more, then I'm off the stage. I propose a toast to every single Rotarian in this club for all the hard work that you gave for the district conference. Thank you. Yes.
During last year, all the clubs got to choose one particular member to you that weren't at the conference probably don't know who we chose. But with Lee Morris, would you stand up because
Thank you, Linda. We do have a new member announcement to make. Jacob Wamigo is CEO and president of Prairie Band LLC, and doggone it, he got tired of going to breakfast early on Friday morning. So he has a transfer from Topeka South Rotary to our club as well, and we're thrilled to have Jacob. Dina Sattler, if you'd come forward, we have your red badge here to award you. Dina is the Kansas Department of Commerce Director of Marketing and Communications. She's sponsored by Dave Heineman and Gordon Lansford. She's been a little busy, and we've been eager to hand her her red badge, and we're thrilled to see you, Dina.
Thanks very much. Appreciate it.
Welcome to the club. Dina, we have a list of items that have to do with club history and service for you to turn that into a blue badge. And for those of you that aren't aware, the red badge is a sign of a new member, and that's an opportunity for those of us with blue badges to look out for you and welcome you to the club and go out of our way to help you feel very comfortable and very welcome. So thank you for joining us. Next, we have Matt Sharbutt to introduce our program. We also have, keep in mind, the opportunity to sponsor a visiting Rotarian next August. So please see Tatiana if you have any thoughts about that at all, or David Beck. Thank you. Matt.
Good afternoon. I would like to introduce our speaker today, Jeff Kahrs, who's down here at this front table. Jeff lives in Topeka with his wife, Felita, and two sons, Samuel and William. Jeff is a fourth generation Kansan who grew up in Wichita. He's received a bachelor's degree in business management from Wichita State. Then later on went to earn a law degree with honors from Washburn. Jeff has 25 years of experience in public service, ranging from, well, starting back in 1995, he was a legislative director for U.S. Representative Todd Kahrs for Kansas. And from 2000 to 2011, Jeff was Kahrs' chief of staff. He was the Kansas Department for Children and Families. Jeff led the effort to transform the state's outdated social services agency into an agency that promotes healthy families and encourages personal responsibility. In November of 2017, Jeff was appointed Regional Director of Region 7, which is Iowa, Kansas, Missouri, Nebraska, and also includes 9 federally recognized tribes. As a presidential appointee, Jeff provides executive leadership as the primary representative for the Secretary of Health and Human Services. The Office of Regional Director, which is located in Kansas City, Missouri, also has responsibility for intergovernmental, it's a big word, and external affairs, which brings together federal, state, local, and tribal governments and private sector partners. So please welcome Jeff Kahrs.
On the table. I'm going to need a, oh, it's on the table. This is what I'm going to need. I'm going to put my, okay, so thank you very much for allowing me to speak before you, and I've got a fairly long, so I'm going to go through some of these slides quickly. I'm happy to stick around afterwards if you have any questions on this topic or any of the other topics that you know that my boss, Secretary Azar, focuses on. So if you think I'm going fast on the slides, I apologize. My staff always puts up a bigger, puts together a larger deck than I have time to do. What's the next page? So anyway, congratulations on being over 100 years old. I've probably spoken to a dozen Rotary clubs, and I really, when I want to speak to a civic group, frankly, just be honest, I just go to Rotary. Nothing against the other ones. My experience is that this is where, you know, the important people of the community, you know, come to meet and do important civic volunteer work. So You already know this because you just got the governor's award, or bell, but I can just tell you from my experience and speaking to over a dozen Rotary clubs, you're a very healthy club. Let's see if this works. Okay, good. So anyway, I'm the regional director. Basically, the secretary is appointed to help oversee the 4-state region. We have about 400 employees. Most of us are down in the federal building in downtown KCMO. I commute. We thought about moving to Johnson County, but after prayer and thought, we said, no, we'd like to speak, we're going to stay here. So glad to be here and commute 71 miles. Yep. Why not stay in the state capital? And I spend a lot of times in the 4-state capitals of the 4-state region, so why not just stay here? So about $20 billion flows into this region from HHS every year. A lot of what I do is to go around and talking about what the priorities are of my boss, which is right here, Mr. Azar, who's in Peru this week. And these are his big 4 priorities: opioids, health insurance reform, drug pricing, value-based health care. I'm not really going to talk about the bottom 3. Again, I'm happy to ask any questions afterwards. Making a lot of progress in drug pricing. You probably have heard that we have a very divided Congress right now. I will tell you that if we're able to get any major piece of legislation through a Republican Senate and Democrat House, it's going to be on drug pricing. So I'd say pay attention there and see what may happen. Maybe infrastructure bill, maybe, I don't know. That's going to come down to a funding issue. But happy here to talk about opioids. This is the president signing in October of 2017 and making a declaration that the opioid crisis was a public health emergency, and it's been extended by the secretary every 3 months. What does that mean? It means a lot of money and a lot of focus is going on opioids. This has been a problem that's been growing for 20 years. The last administration started looking at it, and this administration is tackling it with the support of the Congress as well. This is HHS. I don't know how familiar you are with it. We're 80,000 people. We are a 1/4 of the federal budget. I kid you not. In large part because we have Center for Medicare and Medicaid Services, which is Medicare and Medicaid, so that's the bulk of our budget. But we have 80,000 employees worldwide, about 400 of them in our particular region. There's 10 geographical regions in Kansas. In the States. So these are some of the stats. I don't know how well you can see this, but see, these are some of the stats on what we're dealing with right now, which is by far the worst drug crisis this country has ever experienced, period, bar none. 130 people die every day from an opioid overdose nationwide. Last year we lost over 70,000 folks that died from a drug overdose, not necessarily opioids, although that's the bulk of them. And that's about 200 a day die in America from some form of a drug overdose. Because of that, it is now the #1 cause of accidental death. If you're under 50, it is now a drug overdose. And that problem is still, we still have a major problem. Still with the opioid epidemic, in 2 words, it's wide and it is deep. Not so much in Region 7, again, which is Iowa, Nebraska, Kansas, and Nebraska, or Missouri. And I'll get into those stats a little bit later. How am I doing on time? Really, the regions of the country that are really seeing the epidemic and seeing the high level of deaths are, frankly, in the East Coast, Appalachia areas, West Virginia, Pennsylvania, states like that. For our 4-state region, it's really in Missouri. Okay, so what is an opioid? Everyone here is educated and smart, so you probably know what an opioid is, but basically it's a narcotic. It's a prescribed painkiller. Yeah, thank you. You need to see me, you need to see that. Okay, perfect, it works for me. That's what an opioid is. And frankly, if any of you had a surgery in the last 5-10 years, you probably were prescribed, very well may have been prescribed an opioid if you went under a general anesthesia like I did for a procedure 2 weeks ago at Stormont Bell, great hospital. They used fentanyl. I had fentanyl flowing through my veins during this procedure as well. And then they prescribed me fentanyl or an opioid on the way out, which I didn't need. That's part of the problem. I was able to just do Tylenol for 2 days. I never needed to fill my prescription. That's part of the problem. Here's some stats. Roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them. 20 to 30%. Between 8 and 12% of those will develop a disorder. So stay away, I'm not a doctor, I'm a lawyer, but stay away from opioids if you can. And chances are, if you're good, you may not need it if it's prescribed. You should really ask questions. Do I really need this?
Yes.
Two types, legal, illegal, basically, right? Legal, we're getting a handle on. Illegal, we got a problem. This is an interesting chart. Look at it carefully if you can read it. I can't really read it from here, but this is the source for pain relievers, so opioids and other painkillers for purposes of misuse. And what really this says is that almost 70% of them, of opioids that are misused, are from diversion. Your kid got into your cabinet, or your grandkid got into your cabinet, or your kid or your grandkid's kids got into your medicine cabinet, right? That's where a lot of this is coming from. So we have a serious drug diversion problem in this country. The other 30% are just, they're prescribed legally and they had a misuse problem. So that's why twice a year, just last week, DEA has this thing called drug take-back day, right? And you probably, I never even heard of it before I started working at HHS, which, and maybe that's on me, I don't know. But it's heavily promoted. It's been going on for 16 years. And last week, over 1 million pounds of unused drugs were turned in by good folks like us that were no longer used. They were expired or they're no longer used. Unfortunately, 60% of the folks that are prescribed opioids just hang on to them. And they just keep them in their medicine cabinet for later use or whatever. And that's where our drug diversion problem comes in. Okay, this is a interesting map. It's called a heat map. So this just kind of tells you where we're seeing the increase in the deaths, right? So 2006, 2016, blue is good, red is bad. So last year we had 70,237 deaths, which is about 21.7 deaths per 100,000 people. In 91, it was 6.1. 6 deaths per 100,000 in 91. Today it's 22. So that kind of tells you the problem that we're facing. This is just an interesting chart that my staff found last week, kind of a little idea, shows you what's going on with Kansas hospitals, visitations regarding opioid misuse, folks going in for a drug overdose or whatever. Basically, it shows that, Shawnee County is about twice as many folks as Johnson County, but it's still not a lot. When I go around and I meet with governors and their staffs in the 4 states, they're more likely to want to talk about methamphetamines. They're more likely to want to talk about alcohol. They're more likely to want to talk about, the growing scourge of marijuana, and it isn't scourge. And less likely to talk about opioids. But we do have an issue with opioids. This next chart kind of tells you what's going on with deaths. So these are older numbers, but basically what this chart tells you is that Kansas is about, depending on which information you look at, whether it's CDC or NIH, Kansas is roughly about 45th out of 50 in opioid-related deaths. 50th being the best, the lowest amount, right? Nebraska is 50th. Iowa's 46th. Missouri, it's 18. And it's a large part, and I love St. Louis. It's a great city to visit. They got a great sports franchises there. They got a phenomenal zoo that's still free. I don't know how they afford to do that, even if you don't live there. But they have a serious drug problem there. A very, very serious drug problem. And Dr. Randall Williams, who's the top public health official in Missouri, would tell you that it's ground zero for fentanyl in America. It's certainly ground zero for fentanyl in this region. He would tell you that it's ground zero for the United States. And I've had meetings there. What's my time? Boy, I don't have time to tell you some of these stories. Okay, but anyway, this kind of tells you what's going on. So yeah, we have an issue here, but not that bad. It's amazing. You're in Missouri, you're 18th, you go across the border, and you're in Nebraska, it's 50th. And frankly, Kansas City does not have the challenges that St. Louis does. I mean, St. Louis just has multiple challenges. I've met with their public health officials. I've met with their mayor, who's very sharp and who's on the ball. They have challenges. I've met with their top DEA official for the region that oversees Kansas, Missouri, Southern Illinois. And boy, does he have stories to tell you. Okay, this kind of tells you just how bad it is. We've had crises before with heroin and cocaine, and the DEA guy will tell you that heroin's on its making a comeback. But we don't really see that yet, but he thinks it's coming back. But look at the spike with fentanyl, with opioids. Okay, so fentanyl it's legal if it's prescribed, and a lot of times it's painkiller when you're under general anesthesia. But this is the synthetic stuff that's manufactured in China and shipped over to the United States. The Trump administration recently struck a great deal with the president of China. The president worked it in with trade negotiations to get China to finally criminalize the production of fentanyl. It wasn't criminal. It was not considered criminal activity. And this stuff is very small. I'll show you a chart later on that shows you how small this stuff can be. And so it's produced and manufactured in China, shipped over, either coming across ports of entry, coming across where there's no border security, no border fence, and also through the Postal Service. So these are like the 3 waves of opioid deaths that we've had in the last 20 years: prescription heroin, and now fentanyl, which is driving everything. So this is kind of a scary thing. This tells you that we've had more deaths in the last 20 years from drug overdoses than all of our Americans that died in major 20th century wars. So how did we get here? I'll tell you how we got here. Big Pharma misled people that opioids weren't addictive. Wrong. Lack of education, which is still a problem, including with docs. Americans love their drugs. We love our drugs in this country. I'm just telling you, we love our drugs. 95% of all opioids in the world are consumed by Americans. An overprescribing that's still going on. You know, I didn't need fentanyl when I left the hospital the other day. Got a great doctor. It's a fantastic hospital. I didn't need that prescription. Pain control has been a priority. CMS is making changes in the way that they're basically incentivizing doctors to take care of their patients and making sure they're happy. You go into a hospital room and you see this chart with those happy faces on there. Got to get away from that. Got to get away from that. Another problem is, frankly, we used to have a holistic approach on pain relief. Physical therapy, nutrition, things like that. You guys remember those words? Things like that. And we found out, it's just a lot cheaper to give somebody a pill. So we went away from holistic and went to, pop a quick pill. And so we got to go away from that as well. Anyway, so here, look at this. So look at heroin, look at fentanyl. Now, carfentanil is something even more important. This is how much it takes to die. Okay, so carfentanil is that's a salt granule size, okay? So think about how much you could pack in a postal pack across the border, right? So between 16 and 17, the amount that was confiscated doubled, and the amount that we confiscated was enough to kill 200 million Americans. Federal response. It's comprehensive. This is HHS. I won't get into whether it's not just HHS. I mean, we're dealing with education and treatment and recovery, but Justice Department, DEA, is dealing with stopping the flow of the illegals, because if we don't get a handle on that, we're still going to have a lot of people die. So these are the main things that we're doing at HHS. I'll be quick. Number 1 is improving access to prevention, treatment, and recovery support services. $1 billion, over $1 billion is going to the states, going to the governors for great purposes, for education, for treatment, prevention, and recovery. And we have a vibrant, good system going on in all 4 states. All 4 states in this region get the money, and they're doing it well. Missouri is going to get more, you'll see later on, because they got a bigger problem. Number 2, making sure that naloxone is the overdose reversing drug. We're making it very available. You don't have to have a prescription to have it if you want to have it in your house, because you may have a friend or a child or whatever that is prone to using drugs, and you want to be able to make sure they don't die while they're there with you. And so we've seen like a 400% increase in the amount of that that's made available. 3rd, making sure that our data is more timely. Government's not quick, and they're trying to get quicker on getting better data so we know where the problems are and we can get to it quicker. Supporting cutting-edge research. We've doubled the amount of money from $500 million to $1 billion to NIH to find drugs for chronic pain, for pain treatment that are not addictive. 1 out of 3 Americans suffer from chronic pain, so we've got to have something for them. And so we've dramatically increased the amount of money in research that's going in to find better solutions than something that's highly addictive. And then, advancing the practice of pain management, going back to the basics of a holistic approach and stuff like that. Okay. Sorry I'm so fast. I got a lot of great stuff I want to share as much as I can with you. Preventing addiction, these are things we're working on. I won't walk through that for you. So these are the amount of money that's coming into the region on just this issue, and as you can see, Missouri's getting the bulk of it. And it's because, again, they have, it's ground zero. I mean, they're 18th in deaths. And again, it's really being driven in large part by the synthetic fentanyl stuff. We believe that deaths related to prescribed opioids has plateaued and perhaps dropped We're still, though, maybe seeing a little increase in the deaths related to the illegal stuff. Emerging signs of progress. Okay, so, and I've actually, just the last week before this chart was put together, I've even got some better information that's going on as far as stats. We believe it's possible from very, very preliminary data from CDC that we may have seen a 34% decrease in prescribed opioids in the last 2 years. This administration set a goal to drop it by a third in 3 years. We think that we may have hit it in 2. And it's driven in part by better guidelines from CMS, especially for first-time users of opioids. Frankly, litigation. There's a lot of litigation going on. Let's just be honest. That drives the market. That changes things. And I think in general, people are just, because of the great amount of attention that's been brought by this administration and with help of Congress, more people are asking questions. Do I really need an opioid? Is this an opioid? Do you have something else I can have? Can I have extra sweet Tylenol? Is there something I can use? I went and spoke last summer in St. Louis to a conference, and they had the top pain management doctor there from WashU. You know, one of our top institutions in this country, period. And he's a doctor, I'm not. I won't say what he exactly said, but he basically said, if you take this many Advil and this many Tylenol, no more than 3 times a day, it's non-addictive and just as effective as taking an opioid. You know, we have too many dentists, in my humble opinion, that are prescribing opioids for getting your wisdom teeth out. None of us in here got our wisdom teeth out with an opioid, okay? Why has that changed? So we've seen a huge drop in the amount of opioids prescribed. We've seen a lot increase in the naloxone. It's actually now over 400%. And then the amount of folks that are getting treatment, that are on a medicated-assisted treatment, has increased dramatically. The problem is not enough people that have a substance use disorder are on treatment. So these next charts are quickly. You can just see how we're decreasing opioid prescribed, increase in naloxone, looking ahead. Well, we're basically, you know, Congress just passed this huge bill last year, and we're unraveling it with a lot of money to be attached to it. So this middle thing, I think, really says it the best. You know, HHS is now transitioning from a crisis framework work into an integrated, sustainable, predictable, and resilient public health system to prevent and treat substance use disorder. So we really believe that, you know, great progress is being made. This problem didn't come overnight. It's 20 years in the works. It's not going to go away overnight. But we've made great progress, and we feel positive about the way it's going forward. For us to really win this thing, though, we're going to have to deal with the illegal stuff, period. And it's coming across the border. We've got to deal with that. So Secretary Azar, my boss, likes to say, we are not at the end of this crisis, but hopefully we are at the end of the beginning of this crisis. And what we've seen is that when you make something like this a priority, and you have enough resources from Congress, it's been a bipartisan effort to provide enough resources. If you have the right focus and the right resources, you do get good results. And so that is my presentation. Thank you very much. I don't think I have any time for questions, but maybe I do. I'll tell you what, when the president starts throwing the bell at me, I'll know that my time is up. And I'm happy to ask any questions afterwards when my time's up. Yes, in the back. Yes.
Yeah, so can you speak to what percentage is coming from China and the opioids that are coming when you say across?
The synthetic fentanyl, well, most of it's produced in China. Now, it's coming in from Mexico, but it's also coming through the Postal Service. One of the things that was part of the Support Act, this big 650-page act that Congress finally passed last year sometime, and it had a lot of different moving parts in it, but one of them was called the STOP Act. And what the STOP Act did is it required for the first time for the United States Postal Service, frankly, to do a lot better job in knowing where postals were coming from, having mature relationships with these entities from overseas. Their postals are coming in, just ramping up the security to know this is a secure package, we don't need to be concerned about this. That has always been required from private companies, UPS, FedEx, never been required in the United States Postal Service. So between that and the president of China criminalizing the production of fentanyl and us trying to get stuff off the webs, being able to order stuff on the web, they're hopeful. It's not going to happen overnight, but they're hopeful it'll cut down the amount of stuff that's coming in. But a lot's coming in. A lot is still coming in. Yes.
I was very surprised on the Kansas chart
Okay, which
to
one?
see that 2 of the most serious deaths from opioids were in two of our very smallest counties out west.
Yeah, that chart was actually hospital visitations. So, yeah, I mean, you know, you're going to see it in rural areas. You're going to see there are some rural pockets, but it's also like I'm getting ready to be pulled off the stage here. But Sedgwick County is a challenge. But nationwide, we're doing really well, frankly. I mean, but we don't want to get where these other people are. Missouri is where your prayers need to be focused. Okay, last one right here, sir.
Does the Secretary have any actions against the Sackler family for responsibility of marketing these as non-addictive?
That would be a Justice Department thing, I think, so I can't speak to that, sir. It's a great question. Okay, right there.
Accountability by Big Pharma.
Yeah.
I saw a really good documentary, convincing documentary, that Big Pharma snuck in this little bit in the ability to use this for chronic long-term pain and use these opioids long-term, and that's what started this. So is Big Pharma being held accountable?
I think so. I mean, you're seeing litigation across the country.
Yeah.
I think so. You're seeing litigation across the country, and it's making a difference. But yeah, I mean, they sold it as yeah, I mean, they were not being accurate, were they? Thank you all so very, very much. I really appreciate it.
Thank you for that enlightening presentation. We present our speakers with a book to sign, the book plate, and donate that to Ross Elementary School in your honor. This book is titled Fuzzy. We also will present you with the Rotary four-way test coin. With that said, I'd like to divert to Grant Glenn. We have an amazing presentation coming next week. And Grant, would you tell us a little bit about the folks who are coming next week and why people should attend, please?
We're going to have our own Larry Dimmitt, but we're also going to have the international chairman of the Rotary Committee of Legislation that met earlier this spring, Wayne Benton from Kansas City, Missouri, is on the 8th Circuit Court of Appeals. And he was actually the parliamentarian that ran the meeting, and he's going to give us some really interesting insight of how Rotary works on the international stage.
Oh, that's good.
Thank you, Grant. And so please make an extra effort to make it here next week. And I think guests would find it fascinating as well to be here and get that international perspective and that legislative perspective. With that said, it's fun to have royalty in the room every time we have our district governor in the room, and every time Larry Dimmitt and who knows who else visits us from Rotary International. So what a fun club to be a part of. Let's say the four-way test and conclude our meeting. Of the things we think, say, or do, is it the truth? Is it fair?